I've done workshops for college students who were enrolled in classes to or programs to be support workers. I have a blog called myalzheimersstory.com, and on that blog there are more than 600 pages worth of stories and resources and uh, things that I've learned based on my own experience, and that blog is really widely read. I'm going to have, by the end of this year, it should have had 1 million views, and it's 4 years old. So, you know, I know that's nothing compared to like YouTube, but it's a narrow subject area, and I've been approached by people who are doing training around the world to use some of the resources on my blog, and so it's spreading out in ripples. I've also spoken at conferences here and in the United States, and hopefully I'll be doing something abroad in the near future. My experience is that when you can provide evidence to people, like the exercise that I described with the students and the incontinence briefs, and when you can get people thinking and coming to their own conclusions. So I do surveys that prompt people to think about how the behavior of people who live with dementia is actually normal behavior. It's not caused, in my opinion, and in the opinion of many pioneers in the area, it's not caused by the disease, but it's caused by the way that we treat the people who are living with the disease, whatever disease it is that is causing the dementia. So those kinds of things are usually quite successful in changing people's mind. Not always, but they help people to shift the way they think, which is really a fundamental aspect of change. However, there's also a lot of resistance. So it's going to take a long time to change minds, and we have to keep plugging away at it. That's why I think it's important for students in particular, when they're starting out in their careers, is not to accept everything that they're told, but to question everything that they're told. Why is it done this way? Why is it done that way? And to have an open mind with regards to listening to people who are patients, because the patients are the ones having the experience. And, you know, I remember when I was a young woman going to the gynecologist, and there was an intern or a student physician was with the gynecologist, and I recall the gynecologist saying to the student, well, you know, you're taught that there are no nerve endings in the cervix, but every woman will tell you when you put a speculum in there that, you know, they feel something. And so it's the patient's experience that is truer than the information that may be provided in a textbook. So listen to what the patients have to say. My experience in sharing knowledge and helping to educate people, the most successful bits are when you can actually give stories and examples and show people evidence. That can change minds, but we have to overcome a lot of resistance as well. So.
Mm-hmm.